Welcome to yet another edition of arirangtv's special coverage on COVID-19. I'm Min San-hee. President Moon Jae-in is holding marathon talks with his counterparts worldwide to coordinate measures to fight the virus. In today's broadcast, we sit down with a panel of experts to delve deeper into Korea's quarantine strategy against COVID-19, which has been gaining quite a bit of global attention. But first, as always, we begin with the headlines for today and some of the key words in the news with Kwon So-ah and Noaram. Welcome.
Hi.
So I will start with you with the domestic updates.
All right. Well, for the second straight day, we had cases below the 50 mark, which is a good sign because different from the day before where we had 47 cases, this low number was attributed to the low number of tests that we had over the weekend. Some 6,000 tests were conducted over the weekend. But now the 47 cases we see today is the result of 10,500 cases. So that could be translated as a good sign. Now, the total number of accumulated cases in Korea stands at 10,331. Despite the declining number in new cases, though, 6 people died yesterday, raising the death toll to 192. The fatality rate stands at 1.9%, and almost 100 recoveries were added this Tuesday. Now, while maintaining the stance that it's not time to be relieved, the government did acknowledge the drop in cases as a positive signal. Yoon Tae-ho, a senior health official, said at an earlier briefing that the figures can be seen as an achievement by the nation's people, adding that the strict social distancing measures appear to have been effective. With that, he called on steady compliance with the measures as they will be in effect until the end of next week. Now, authorities also are expressing their concern of COVID-19-like symptoms or people catching the cold due to the big temperature gaps, and calling on people to not go to work and rest if they do show any of those symptoms.
I see. Now, self-isolation, of course, is very important to curb the spread of the virus, but I understand the government is now mulling over the possibility of introducing electronic tags.
Right. The government is underway on discussions on people entering South Korea, maybe making this as a requirement to wear electronic bracelets so that authorities can better monitor them. This idea has come up as more and more cases occurred where people did not abide by self-isolation rules. For instance, leaving their cell phones at home, which has an application installed for authorities to monitor them. Now, following working level talks, a final decision is expected to be made at Central Disaster and Safety Countermeasures Headquarters meeting. There are voices of concern, however, on human rights violation, because some believe that this reminds them of, sex offenders who have to wear such bracelets as well. But the government needs the consent of those people who have to go into self-quarantine before these bracelets are applied.
I see. Okay, elsewhere in the world, I understand the virus is keeping its grip quite tight on the U.S.
Well, on Monday local time, the death toll in the U.S. surpassed 10,000. And health experts are warning the national count may be underestimated. Now, U.S. President Donald Trump at the White House daily press conference said, however, quote, tremendous progress has been made in a very short period, and that he's aiming to lift restrictions to the people's daily lives by April 30th as planned. Now, new government reports, meanwhile, showed hospitals are facing severe shortages in medical supplies. Meanwhile, New York Governor Andrew Cuomo suggested a possible flattening of the curve in New York as the death toll has been slightly going down in the past 2 days. Now, the total number of cases in the U.S. now stands at more than 360,000. Deaths are slowing down in Spain, although recording more than 13,000. Italy, Germany, France are also countries in Europe that are seeing drops in infections and deaths. So there is a slight glimmer of hope that the worst may be over in those regions.
Right, but still the numbers are quite alarming. All right, So thank you for that. Aram, the UN Security Council has been quiet on the COVID situation, but it's poised to hold a meeting this week.
That's right. The UN chief Antonio Guterres is scheduled to, or reportedly going to brief the UNSC members this week, though a specific date hasn't been set yet, but reports are suggesting that Thursday might be the likely day the meeting is held. The meeting has been requested by 9 out of the 10 non-permanent members who formally requested the meeting. There are still divisions, though, among the UNSC's 5 permanent members, especially between the US and China. Beijing has been resisting talks on a global scale because it feels it will be cornered, especially by Washington, because that's where the virus originated, and there has been a battle between those two countries over the kind of spread and the cause of the virus. It's not yet clear what form the meeting will take or what could be accomplished, to be honest. Since the UNSC deals with geopolitical security and peace matters, it remains to be seen what the group can actually do in regards to the pandemic. Last week, though, the UN General Assembly adopted a resolution calling for international cooperation and multilateralism in the fight against COVID-19. That was the first text to come out of the world body since the outbreak first began.
Right, I see. I also understand the Global Health Organization has asked President Moon Jae-in to come to the forefront of the fight against the pandemic.
Yeah, so the WHO chief was full of praise for President Moon in his country's dealing with the crisis. Dr. Tedros Ghebreyesus told Moon that Korea's, quote, comprehensive strategy involving aggressive testing, diagnosis and tracing is working effectively. He also thanked the president to encourage global leaders to learn from South Korea's method. The WHO leader also asked for the president's support in providing medical supplies, including test kits, to sub-Saharan African countries as well. Ghebreyesus also invited Moon to deliver a keynote speech at the World Health Assembly, or the WHA, in May. The WHA is the decision-making body of the WHO and the world's highest health policy-setting body, so a keynote speech there would be quite significant. Moon accepted that invitation and said he would consult with the Foreign Ministry to make the necessary preparations. The leaders of Germany and South Africa are the other leaders to speak at the WHO.
I see. And speaking of leaders, UK Prime Minister Boris Johnson, I hear there's some alarming, concerning news about him.
That's right. Prime Minister Boris Johnson, Downing Street, has confirmed that he has been moved to an intensive care unit after his symptoms worsened. He was admitted to hospital after persistent symptoms just the day before. He was admitted into ICU on Monday and he was admitted into hospital on Sunday. That move on the admission to hospital on Sunday, the Downing Street said that move was a precautionary measure. And according to reports, Johnson has been moved to the ICU also as a precaution, just in case he requires the aid of a ventilator. The Prime Minister has asked Foreign Secretary Dominic Raab to deputise where necessary. Raab chaired Monday's regular morning coronavirus briefing and made a televised statement saying the government will continue the Prime Minister's direction in responding to the outbreak. Support has been pouring in for Johnson from both his own party and the opposition, as well as other world leaders such as US President Trump and the French President Emmanuel Macron as well.
I see. Now, in Japan, we have the Prime Minister poised to declare a state of emergency. Is that correct?
That's right. He is poised to declare a state of emergency in Tokyo, Osaka and 5 other prefectures later today. He said he would do so in a press briefing yesterday, while also announcing a huge stimulus plan to the tune of nearly $1 trillion to help the economy in Japan weather the virus. The government is hearing opinions from an advisory panel of experts before issuing the declaration. The measure, to go into effect for about a month, will enable local authorities to close schools and businesses, but these local governments do not have the legal authority to force people to stay at home. They can only advise that citizens stay at home. And Abe did say in his press briefing yesterday that lockdowns will not be imposed, as we have seen in other foreign cities as well. The government is also set to revise its basic guidelines for dealing with the outbreak. And Abe will hold a press conference at 7 p.m. Korea Standard Time, which is the same time in Japan, to explain to the nation how the emergency declaration works.
All right, Aram, thank you for that. We'll see you, Aram and Soha, tomorrow. Thank you for the updates. It's a little after 2 in the afternoon here in Korea, and we're poised to join the Central Disaster and Safety Countermeasure Headquarters for the latest briefing on the COVID situation in this part of the world. And while we wait for the briefing to commence, here's a reminder to those of you in the country. Authorities here have extended the social distancing campaign to April 19th. We'll be back after this briefing.
We will have Mr. Kwon Joo-nuk who will be briefing us, and it will be followed by a Q&A session. And here is Mr. Kwon Joo-nuk, the deputy head of KCDC. Let us now begin our regular briefing for April 7th, Tuesday, on the coronavirus outbreak here in South Korea. The total number of confirmed cases now stands at 10,331. This includes 802 imported cases from overseas, and among them, 92.1% were Korean nationals. And 6,694, or 64.8% of the total, have been discharged following full recovery. Yesterday, we had 47 new cases, and 96 more people have been discharged. And unfortunately, we had 6 more fatalities. And the regional breakdown is as follows. Aside from the imported cases, we had 30 cases in the countries across the country. And we believe that from these, we will have some cases that are related to imported cases based on a further investigation. And aside from Daegu City, most of these cities and provinces had one-digit number of on-day increase. And overall, 82.3% were related to cluster infections. And we are currently under investigation for 9.2% of the cases, which is below the 10% mark. And the imported cases is as follows. Yesterday, we had 17 more imported cases. 14 of them were Korean nationals, and 3 were foreigners. And from U.S. had the largest portion with 13. And by looking at the trends of the outbreak in the regional sectors, relating to the Ujeongbu St. Mary's Hospital in Gyeonggi-do Province, we have 48 confirmed cases so far. And in Daegu, the second Miju Hospital, we also had those patients and staff members who were screened, and we have 11 new cases, which make our total to 185. And unfortunately, one of the nurses who were taking care of the patients have been tested positive, and we are currently tracing this person's contacts. And the KCDC currently laid out detailed plans to make a safer environment for healthcare providers. And at the Korea Healthcare Institute, we are trying to develop our research on the antibiotic of the coronavirus patients, and we will be using this to analyze the disease and the virus. And also, we are currently trying to make the similar aspects for the vaccines to treat the COVID-19. So this will be commenced in the near future. And from April 1st, the government has imposed a 2-week mandatory self-quarantine for all inbound travelers. And during the self-quarantine period, in order to prevent family transmission of the virus, we advised everyone to use their own items, utensils, and personal belongings. We make this very important, but if you fail to comply with self-quarantine regulations, they will be subject to imprisonment of up to 1 year or fine up to 10 million Korean won. And actually today is the World Health Day designated by the WHO. And today, marking this occasion, we had a moment to have a silent tribute for those who have lost their lives due to the COVID-19. And we also sent our deepest gratitude to all of the medical practitioners who are fighting on the front lines against the COVID-19 virus. And at the end of the briefing, we will be talking about the social distancing measures. And this is to all of the public. We ask you to participate in the extended social distancing campaign, which has been extended to April 19th. The social distancing measure is the strongest preventive measure, and today and yesterday, the confirmed cases have been below the 50 mark. And by period, this actually shows that from March 22nd, we have implemented the enhanced social distancing campaign, and we believe that this first week of the campaign results are currently bearing fruit. And the second week of that, as well as this week's campaign, will also yield fruits in the near future as well. So against this backdrop, the purpose of this campaign is as follows. Among the patients with symptoms, as well as the transmission through asymptomatic patients, we will be curbing their spread. And we said this multiple times, but the virus can be spread very silently among those who have no symptoms as well as those who have early symptoms. So this is very, very contagious. And when you look at the many countries that are currently having difficulties, when we look at their current status quo, if we did not carry out the enhanced social distancing campaign, these trends that are happening globally are also to be repeated here in South Korea. And by participating in such campaign, we will be able to identify at an early stage those people with symptoms as well as asymptomatic patients. We believe that this measure is very preventive, very strong in prevention. So we ask you to take part in the campaign. If we have 3 weeks of a social distancing campaign, many experts say that we can decrease the infectious rate by 95%. So we believe that these effects will bear fruit at the 4th week, the last week of social distancing campaign. So we ask your participation. And the South Korean government is actually trying to, and we have already implemented our measures to carry out everyday life quarantine, because many of you have always washed your hands on a daily basis, and you have enhanced the way of visiting hospitals. And we also had distances over 1.5 meters in between the hospital beds, and we also secured more nurses so that we can expand the coverage of our health insurance and health coverage. So it is not an exaggeration to say that the South Koreans have been carrying out our everyday life quarantine. So if we cooperate further and participate in such social distancing measures, we can overcome this outbreak. And even at the medical sectors and your homes and your businesses, many of you are participating in such a campaign. We would like to extend our deepest gratitude as well. Thank you very much.
Right, that was the Central Disaster and Safety Countermeasure Headquarters with the latest on the COVID-19 situation in Korea. As announced earlier, Korea recorded 47 new cases as of early Tuesday, marking a second day for that number to stay below 50. The total number of infections now stands at 10,331. Authorities are nonetheless calling on the public to practice good hygiene and continued social distancing as part of efforts to keep the virus at bay. Meanwhile, thousands of COVID-19 patients are fighting for their lives in hospitals across the world. Korea is no exception. Here, patients undergo treatment in isolation and must test negative twice before they can be discharged from the hospital. In this next video, we meet a young patient in Korea who posted a daily diary on his YouTube channel recounting his experience.
코로나 확진을 받고 1일차에 돌입했습니다. 저는 이번 학기 한 학기 동안 미국에서 원래 교환학생을 하는 걸로 되어 있었는데요. 교환학생 프로그램 중반에 갑자기 미국에서 코로나가 급격히 확산되면서 학교가 그냥 셧다운 됐습니다. 자가격리 수칙을 지키면서 방에서 생활하고 있었는데 갑자기 그 미국에서 저랑 같이 생활을 했던 친구가 코로나 확진이라는 그 결과를 전해 듣게 되어서 바로 다음날 오전에 드라이브 스루를 통해서 코로나 검사를 진행했습니다. 진단을 받게 되고 오늘 아침에 확진이라는 판정 결과를 받게 되고 바로 입원하였습니다. 오늘은 코로나 확진 2일차인데요. 저는 열도 거의 없고 기침도 안 하는 상태고요. 두통은 계속 있는 것 같습니다. 그래서 밥 먹고 검사 받고 자는 거 말고는 할 수 있는 게 되게 많지 않아요. 저는 컨디션이 계속 좋고 이제는 증상도 거의 찾아볼 수 없어요. 병실을 음압으로 만드는 기계인데요. 24시간 가동되는데 생각보다 소음이 큽니다. 또 밖에는 벚꽃이 폈어요. 저는 벚꽃이 이렇게 빨리 피울 줄 몰랐는데 바깥 공기가 얼마나 따뜻할지 너무 궁금하네요. 제가 여기서 느낀 의료진들의 노고에 대해서 같이 이야기해보고 싶어요. 개인복을 입고 아침 새벽 6시부터 개인 검사를 하는데요. 이게 또 환자 간의 감염도 완전히 배제할 수 없어서 이것을 한 환자를 검사하고 또 소독하고 또 다음 환자를 검사하고 소독하고 이런 식으로 이루어지기 때문에 참 손이 많이 가는 일입니다. 이것을 하루에 3번씩이나 하고 또 환자들 식사도 직접 가져다 주세요. 그리고 물도 직접 가져다 주시고 또 환자들 컨디션도 일일이 체크하시고 의사 선생님 같은 경우에도 하루에 몇 번씩 오십니다. 이번 10일차에 코로나 검사를 다시 진행했는데요. 결과는 아쉽지만 양성이 나왔습니다. 적어도 4월 15일 전에는 퇴원을 할 수 있을 것이라고 예상하고 있습니다. 제가 꼭 건강하게 무사히 퇴원해서 많은 사람들의 희망이 되고 싶습니다. 우리 모두 힘을 합쳐서 이 어려움을 슬기롭게 극복했으면 좋겠습니다. 감사합니다.
코로나19에 효과적으로 대응하고 있는 우리의 경험을 국제사회와 공유할 예정입니다.
In today's studio discussion, we touch upon Korea's strategy to fighting COVID-19, one that has been garnering quite a bit of interest from its counterparts elsewhere, as Korea was once a hotspot, but has since worked to contain the coronavirus within a certain capacity. For more on that, I'd like to welcome Professor Byung-wook from Sun천향대 University. Welcome, Professor Yu. And Professor 탁상우 from Seoul National University. Hello, Professor Tak. First, we'll start with you, Professor Yu. I think it's safe to say the world was caught off guard with the corona pandemic. What are some of the factors that may have led to the explosive spread of the virus worldwide?
First of all, we don't know still yet about coronavirus, its character. But these days we found that many people know the writing like R0, but actually it's R0. It means reproductive factor. So coronavirus infected one person, at least it created 3 persons more. After that, 1, 3, 9, and 27, 81, and producing a lot. So this is a kind of factor compared than influenza. Influenza only 1.1. That's why only the flu season is gone and we couldn't see the flu patients too much. But corona-19, at least 3.0 is producing now. So we don't know exactly, but it's around 3, which means it's more than influenza. That's why it's coming to true. And other one is a 대구경북 province is related with the Sincheonji religion groups. They are, coming all together in the closet, and they are deeply touched and outbreaking. But that time, we still didn't know what is the coronavirus exactly spreading to all the communities. We just know about the wearing mask and keep the distancing and keeping washing hands, but we don't know what exactly going on. But right after that, Korean government and Korean Medical Association will catch it up to the condition, and then we can protect until now.
Oh, I see. And research is still continuing, of course.
Still, research is continuing, and we're looking for the solution and the vaccine too.
I see. Professor Tak, would it be accurate to claim that Korea's early response to COVID-19 was quite well carried out? I mean, when you compare this with efforts in the US and Europe, what are your thoughts?
I should say the leadership actually determines everything about the initial response. People like me, public health professionals, often say prompt response in the public health emergency is the most critical aspect, and the prompt response is not there in the government setting. People in the government, they know that there is no promptness in the government work because there is a regulation, there is a policy, so you have all the regulations to abide by. Only leadership can actually cut down the regulations and policies and expedite the process. So we do have process, and other countries have those process. But the leadership, when leadership is alert enough and informed enough, they can make a decision that can actually have impact on this kind of event.
I see. Professor Yu, despite being forced to close his border with the US, Canadian Prime Minister Justin Trudeau has reportedly voiced support for President Moon Jae-in's open door policy amid the pandemic. Is Korea's insistence on keeping its borders open an indication of its confidence that the virus can be contained without complete lockdowns of the country?
Well, there are many opinions, even the doctors group, but from the beginning, I'm instantly claim about no lockdown in Korea. Why? Because it's a COVID-19, its character, we already experienced from the MERS coronavirus. MERS coronavirus originated from the Middle East. It was 2012, but happened in Korea 2015. And still, Middle East countries, they experiencing about MERS coronavirus, still until now. Which means these days, 100 years before, from Hong Kong to London, we have to move to the shipping at least 6 months ago. But now, air shipping, just a few hours, we can go everywhere, which means 1 point outbreak mean already spreading all over countries. Nowadays, we do our best for the personal social distancing. This is the best way people will get the medicine and the vaccination. But that time, if you do the block border, probably our economic condition is more, collapsed. So second, in my opinion, after the MERS coronavirus crisis in Korea, Korean government and the medical institutes, we are preparing some. So I heard from my close friend, he told me that we got it, all the systems prepared December 2019, just a few days before it happened. So fortunately, Korean government, we prepared that. That's why probably the cabinet of Korean government knew about this. That's why we never locked down. I'm still support about it.
I see. So you're still supporting the open door policy?
Absolutely.
And having been able to be prepared before, a few days before the actual outbreak in China, we can say that luck was also on our side then?
Yeah, people said is that moment, if we blocked our border, probably some countries say, oh, Korea is started from, because we are just neighbor country from China. But why we cannot block? Because there are many regions, Korean nationalities, people who live in Korea, who live in China, we have to take care of them because government is region to there, but take care of their people, isn't it? So there are no way to lock down anyway.
I see. Professor Tak, speaking within your capacity as a former researcher at the US Centers for Disease Control, what can you tell us about the tasks being carried out by health professionals and quarantine personnel worldwide right now?
I have to tell you that there are only health professionals and responders. There are a lot of people who are actually working to help the public stay at home. So these people initially they spent a lot of time finding the contacts and exposed people, and also they were isolating and quarantining all these potentially infectious people. Right now, thanks to the ICT capacity that Korean government has, they cut the time to find out the contact and potentially infectious people. They spend more and more time to find out what the best strategy and what the best intervention methods will be to minimize this impact of this event.
Professor Yu, in its initial stages, if I remember correctly, the virus seemed to be within a certain control. But then, like you mentioned, we had the cluster infection in Daegu, and then we were reporting hundreds of cases in a matter of days. How severe was the situation back then, and how were we able to overcome it in time?
Well, first of all, I'm deeply sad because we lost one doctor in the Daegu Gyeongbu province. Like not only doctors, all the medical staff in the hospital and also quarantine officers from the government, they do their best. But what you mentioned is outbreak couldn't expect it how to spread it from the beginning. So who is contaminated, who are infected, can be contagious, we didn't still know. But these days we are just catch up how to. Also, government, someone say it's a little late to respond about this, but we did do our best because there are many hospitals already, and also we are distributing 생활치료센터, which means for distributing the classified patient condition to be stayed in some officers, the training center, human resources development center, or some regional or hotel. We are changing to keep on the patient, don't move and don't touch the other persons. So that's why we are successfully now under control it. But from the beginning, I told you there are many sacrifices of the doctors, nurses, and hospital staff and officers from government. Still, many people are suffering. They fight against to keep their life in the intensive care unit. Hopefully they will be back to us.
Right, and because of their sacrifice, we're able to keep this virus under control here in Korea to a certain extent, of course. Now, Korea's IT industry has also joined the global fight against COVID-19. A case in point is the presence of smartphone apps that provide the public with essential information about the virus and more. To take a look.
South Korean IT firms are trying to find innovative ways to help prevent the spread of COVID-19. Many solutions and platforms have been developed in this context. A number of smartphone applications have been developed, giving citizens access to a wealth of information, including those of infection paths and nearby testing centers.
각 지역별로 얼마나 많이 증가하고 있는지 그게 가장 도움이 많이 됐던 것 같아요. 특히 동선 같은 부분이 어느 식당에 갔고 어느 병원에 있었고 또 여기에 몇 시에 방문을 했고.
Corona Map, released in late January, was the first platform of its kind to provide users with information related to COVID-19. Infections paths and quarantine locations are overlaid on top of an easy-to-use map.
코로나 맵을 처음에 기획을 했을 때는 이제 코로나가 많이 이슈화 됐을 때였었거든요. 그때 이제 SNS나 미디어 매체에서 코로나 관련 정보들을 약간 선동하거나 공포를 조장한 정보들이 많이 있더라고요. 그래서 그런 것들 좀 해결하고자 질병관리본부에서 제공을 하는 옵션 데이터를 가지고 지도위에 표시해주면 좋겠다 싶어서 기획하고 개발하게 되었습니다. 이런 식으로 확진자 이동 경로 탭이 있고요. 어떤 확진자가 언제 그리고 어디를 방문했는지 이렇게 정보를 표시해주고 있거든요, 텍스트로. 그래서 이거를 이제 바탕으로 예를 들면은 서초구 보건소 선별진료소로 한 데 있으면은 입력을 하고 엔터를 누르게 되면은 입력이 이렇게 자동으로 폼이 되고요. 이것들을 이제 여기다가 이제 붙여넣기를 하면은 자동으로 이제 업데이트가 준비가 끝났습니다. 그래서 서버에서 이제 업데이트를 하게 되면은 코로나 맵에서 이제 확인을 할 수 있는 그런 시스템으로 구성이 되어 있습니다.
It is freely accessible via PC and mobile devices and used by more than 500,000 people each day. Mask Map, an app which shows the location of available masks and their inventory, and Corona Me, a website which identifies nearby infection paths, have also been developed.
제가 준비하고 있는 거는 코로나 자체가 좀 이제 색상별로 이제 구분을 하고 있는데 생맹이신 분이 있으시더라고요. 그분들은 또 이제 그런 것들을 또 알기가 좀 어렵다고 하셔서 그걸 어떻게 하면은 생맹분들도 좀 효과적으로 정보를 얻을 수 있을까 해서 그런 것들을 좀 UI적인 개선이나 기능적인 개선을 지금 하고 있고요. 또 이제 외국에서 좀 많이 이제 어드바이스나 오퍼가 많이 들어오는 상황인데 그런 분들을 위해서 지금 소스를 아예 오픈화 시켜서 그분들이 각자 나라에 맞게 커스터마이징을 할 수 있도록 지금 준비 중에 있어서 개발자로서 가장 중요하게 보고 있는 거는 사람들한테 좋은 영향을 끼칠 수 있는 서비스를 지속적으로 만들어내는 거라고 생각이 들고 코로나 맵도 그래서 만들 수 있었다고 생각이 들고요. 코로나 맵뿐만 아니라 앞으로 그런 마음가짐으로 지속적인 서비스 만들어내는 게 목표입니다.
South Korea's IT industry is now on the front line in the fight against COVID-19 and is playing an important role in both prevention and containment.
Well, the maker of that piece of technology is poised to share his know-how to allow people overseas to create maps that are custom-tailored to their specific locations. Meanwhile, Professor Tak, it appears that President Moon Jae-in has been receiving quite a lot of phone calls from his counterparts worldwide, given the interest in Korea's quarantine measures and equipment. What do you make of this?
I often say we're all in this together because this is a global health issue, and people like us, Professor Yu and me, we spend a lot of time looking at global health issues. Now, we truly have a global health issue, but there's no global health collaboration happening. And I'm glad to see that President Moon actually offers some help and assistance to those countries in need. And I know those requests are basically on the diagnostic testing and some of the equipment, but also how to deal with this kind of unprecedented event. And I think it's the time that Korea government is actually taking the lead on how to promote the global collaboration to defeat this disease. So I'm glad to see that this is a good sign.
Right, it is. Professor Yu, would you link Korea's success so far in dealing with the virus simply to its competence, or would you link it also to luck, perhaps? Because we have developed countries with highly well-developed medical systems asking Korea for assistance. What are your thoughts?
First of all, Korea, we haven't experienced MERS coronavirus. After that, we're preparing since after the MERS coronavirus outbreak 2015 and 2016. After that, we have an experience because MERS coronavirus just is like a story of the far, far, far away, but exactly happening in front of us. The moment we realize that anything can happen in Korean Peninsula. That's why we're preparing. But other developed countries, I believe their medical technologists and the skill of the treatment is the same as like Korea, or a little more better, but they ignore that can be happen their mainland. That's why they're not prepared well. Some countries, my wife told me, honey, why did it happen in European countries and even the United States? Because they forget. Because just inner peace, that's why they are, nature-based instincts to fight the virus, they lose of this. But after this, what the Professor Tak comment about it, global cooperation against the virus should be starting from now on. And then Korean government and Korean techs, we are ready to share for all. We can move together. That moment we can elect coronavirus.
Yes, another sad reminder that we are all vulnerable to this virus, regardless of what part of the world we are in. Professor Tak, do you agree with the assessment that Korea's triage centers that handled the mild cases of COVID-19 helped ease perhaps the burden on hospitals?
Yes, that was a very smart move. Actually, one of the core capacities in the public health response system is having the preparedness for medical surge. capacity. And medical surge is happening in countries we see, Italy, Spain, and United States. And these are the situations that we should have dealt with if we didn't have enough time to prepare for this. And medical surge is something that we cannot avoid if this outbreak is on its route. And because of that triage care center, we sort of categorize those mild symptom cases into a different facility so they get their accessible medical attention while other medical staff can take care of those vulnerable but treatable people.
I see. Professor Yu, the government has recommended citizens to practice social distancing, but we still have concerns about imported cases and cluster infections. Do you suppose we need to take, maybe at this particular point, a tougher approach to handling the virus, or should we maintain what we have right now?
So the Korean government, they do per stepping to the block. So these days, from the 1st of April, we did and we doing the high level of kind of the selected, the incomings control. So which means many Koreans who live in the out of Korea, they wanted to come. There are many regions. Anywhere there are Koreans, and Korean government should be hugging and embracing to take care of them. So that moment, if we the block, is ridiculous because I told you already, the reason why the nation and the government, because for the soul for the people. And other one, so Korean government, they probably very difficult to decide the block or not, lockdown in Korea. Korea country is a trading country. We are kind of open market. If we give the impress to the other country, Korea is locked down, we cannot say anything right after the Corona-19. So otherwise, these days, Korean government keeps saying to the people are social distancing and the personal hygiene keeping. Actually, this is the best way to prevent an unknown virus. So, yeah, I know. Also, I'm a little bit fatigued. My kids, they're boring in the home. But I believe that if the virus always leaves us, human being lives among the huge number of virus. Actually, we are teaching the virus more. Now, virus payback attacking now. But anyway, we're going to live together, which means so we get used to live with or without Corona-19. Anyway, life will be changed. So which means nowadays, Korean government is doing the stepping. I agree about it as doctors.
I see. So not closing down borders is ensuring both our economy and also the health of the public then. Professor Tak, do you agree? Do you think we should? Well, I'll be interested in your opinion first. Do you think we should continue?
I'm sure public is getting tired of practicing social
distancing. We are,
yes. But I also believe that the public is getting a hang of it, so they know how to do it while they perform their own necessary daily lives, and they maintain their own critical things in their lives. What's missing is right now is that we have to make sure that there is a certain apparatus to make sure that once we have case clusters or cases, we have to detect them in a timely manner so we can respond and contact them and then contain the case cluster within the boundary. So we have to have the system ready before we release and ease on the burden of social distancing.
I see. All right, Professor Tak, Professor Yu, thank you very much for your time today.
Thank you.
And that brings us to the end of this edition of COVID-19. We'll see you tomorrow at the same hour. In the meantime, arirang.tv would like your thoughts and inquiries with us on our social media accounts or our homepage, arirang.com. Thank you for watching.